Health is fundamental human right. When we look at basic facilities, which is required to every human being, that is basic facility such as food, shelter, health, education. So in this context, when we look at global health sector, it is facing a lot of crisis. That's why United Nations and World Health Organization make agenda every year to improve the health sector across the globe. When we look at a global health crisis, Universal Health Coverage Day is celebrated every year on 12th December. For this year, the theme is Health for All, Time for Action. Global health crisis is increasing day by day owing to rich and poor gap in the society. When we look at the situation across the globe, a lot of diseases increasing, such as pandemic, epidemics, viruses. So when we look at previous years, we find that there was COVID-19, and then we look at hepatitis, AIDS, pneumonia, cholera, and the diseases which are emerged due to climate change as well, like foodborne diseases, waterborne diseases, airborne diseases. So these things are happening across the globe. And the Universal Health Coverage Day is celebrated each day. It is an initiative by world community to bring awareness and push countries to to provide basic fundamental human rights of each and every person across the globe, to provide them equitable, equal, and affordable healthcare. When we look at global statistics, we find that there are half of the population of the world is facing a lack of access of healthcare. And there is a report which tells us that due to poor facilities, nearly 35 lakh people died every year. On the other hand, nearly 50 lakh people died due to lack of basic healthcare. So when we find that we have a lot of issues, and our sustainable development goals could not be fulfilled, the reason behind the health is related to sustainable development goal number 3, which means that good health and well-being. When we look across the globe, we find there are two type of threats which are due to due to insecurity in the society, and which create further health crisis. First of all, when we understand that there are traditional security threats like wars, war crimes, humanitarian issues, conflicts, and crisis, clashes across the globe, such as when we look at Israel-Palestine crisis, the conflict where there is a lot of death and the disaster in the health sector, and due to the attack of Israel on Palestinian people. On the other hand, we find that there is Russia-Ukraine crisis and many other crises, many other conflicts are going across the globe, which is due to the attackers, the powerful nation, or the two enemy countries fight together to achieve their political vested and national interest. And when we look at the other type of threat, that is non-traditional security threats, such as we can see that like social issues, climate issues, and food insecurity, human insecurity, economic inequality, and a sense of deprivation we find across the globe. And one of the major reasons behind the global health crisis is climate change. Climate change is behind food insecurity, health insecurity, shelterless people are there. The incident which occurring due to climate, like melting of glacier, heat stroke, smoky fires, wildfires, and deforestation, floods, storms, and various disasters which are occurring due to use of fossil fuels and human activities took place across the globe. That's why this time in COP28, the conferences of parties on climate change in Dubai, they have made a special agenda. They have proposed an agenda to look at health crisis. They have explained, they have proposed the agenda, the nexus between climate change and global health crisis. And 124 country endorsed this idea, and $1 billion has been allotted to invest to be used for the maintenance and to provide quality, equitable healthcare across the globe. So this is the global situation across the world. And now we look at the situation of Pakistan. Pakistan is a developing country and it is facing a lot of issues. And when we look at the population of Pakistan, there is 240 million people in Pakistan, and they are facing a lot of non-traditional security threats such as food insecurity, climate change issues, water crisis, energy crisis, and hunger issues. When we look at the development indices, like Human Development Index, Pakistan is at 161. When we look at poverty index, Pakistan, 40% of people are living below poverty line, and this is also Sustainable Development Goal number one. And when we look at Sustainable Development Goal number two, which tell us that Pakistan is at 99. So how we achieve zero hunger? So when we understand that the first two Sustainable Development Goals are unfulfilled, so how we move toward third one, and the third one also create further piling of the first two. Poverty is reason behind health crisis, and health crisis also create poverty in the country. And when we look at the diseases which are commonly spread across the Pakistan, such as Pakistan and Afghanistan are the two countries which are still facing the issue of polio. Pneumonia is common in Pakistan, foodborne diseases due to contamination and pollution at various levels, such as water pollution, air pollution, soil pollution. And when we look at air quality index in Pakistan, and Pakistan is the fifth most vulnerable country in the climate index. And when we look at the safe sanitation and clean water situation, Pakistan is facing a lot of diseases such as cholera, diarrhea, dengue, malaria, and other diseases such as hepatitis, AIDS, cancer, tuberculosis, and diabetes. These are common, and it is increasing day by day in Pakistan. And when we look at the economic and financial situation of Pakistan, Pakistan is facing a lot of crises at various level. So there is an issue that there is lack of funds in health sector. The contribution from the GDP of Pakistan, it is less than 2%, which is invested on health. And the demand of medical association for 2023, they demanded 5% for this, and which is also a global standard, but it was allotted just below 2% for health sector. So health is not a priority. When we look at global institutions such as World Health Organization and various institutions which are working for sustainable development goals, they connect health with fundamental human rights, which is necessary for the development of society, which is the name of development when there is universal health care, and it lead towards peaceful, prosperous, and secure country. And when there is health crisis, when we find that a lot of people in Pakistan are facing issue of food insecurity, food wastage, and the issue of water crisis, as well as the issue of cleanliness in context of water. So that's why the situation in Pakistan is dismal in health sector. Also, when we look at stunted growth of children, 40% of children could not have food, and they are facing the issue of malnutrition. And also, when we look at the maternal mortality rate, life expectancy, and all things connected with the health, so Pakistan is facing health crisis. So what is the solution when we understand the crisis is there, and our whole community across the globe, as well as the people of Pakistan, is struggling in this sector? First of all, we have to look at individual level. We have to take care of ourselves. We have to manage food for ourselves. We have to balance our diet. We have to take proper protein, carbohydrate, lipids, and vitamins. Yes, this is difficult in Pakistan nowadays due to food insecurity and inflation. We could not eat fruit and even meat and beef. That's why at least we have to take care of ourselves, because preventive healthcare is better than going for treatment. So prevention is better than cure. So this is also the health is wealth, and according to Mahatma Gandhi, he said that the pieces of gold and silver is not real wealth, but the real wealth is your health. So we have to go for preventive health care, such as many countries adopted this formula. So we have to take care of ourselves, our diet, what we are taking, what we are drinking, and what is our lifestyle. Is it lazy or it is meaningful? And at societal level, we have to adopt the suggestion given by global institution, our national institution, such as in COVID-19, what we have faced, as we did very well. And when we look at the Universal Health Coverage Index, Pakistan has improved despite the crisis and lack of finances. So Pakistan has improved from 40% to currently Pakistan is at 52.7% at Universal Healthcare Index. So despite this, we have to bring awareness in society through media, through education, through civic education, through our religious institution, so people take care of their health on priority basis. And the third thing, we have to at political level, the government and opposition need consensus on this to make it priority, to make it national interest. Also, we need cooperation at federal and provincial level. We need public and private partnership. We need to adopt where we need technology. We have to adopt such things which are sustainable in context, and we need to address our climate issues. So that's why, because it is human rights, and when we will full fundamental human rights basic facility of our citizen, then things will improve. And when there is healthy mind, and when there is healthy body, healthy mind, and there will be welfare and there will be well-being, then things will improve in society. And it is a global issue. We need global cooperation, and we have to adopt global suggestion for the betterment of our citizen.